And now I would like to introduce our next speaker, who is Dr. Walter Renner, talking about lay help as a means of social support for trauma survivors among refugees and asylum seekers. And Dr. Renner is a clinical psychologist and full professor at the Pan-European University in the Slovak Republic.
Ladies and gentlemen, I'm pleased to talk to you today about lay help as a means of social support for trauma survivors among refugees and asylum seekers. Just a few short words on the background. In 2014, according to the United Nations High Commissioner for Refugees, there were a total of 264,000 asylum applications in Europe and 330,000 worldwide. So you see about 80% of the world's asylum applications are filed in Europe. Also, Greece saw a dramatic increase in refugee and migrant arrivals by sea, as everybody knows, so I won't go into much detail here. Currently, the distribution of asylum seekers and refugees, as we all know, among the member states of the European Union is being reconsidered. These are the rates. You see the blue line over the year, the total, and you also see the new applications in 2014. I will talk to you about acculturative stress among refugees. Migration is a stressful experience, but there is quite little research done about this. Acculturative stress may be due to all the challenges of adapting to many changes in the course of acculturation, and many migrants have to deal with conflicting demands from their own ethnic culture on the one hand and the host culture on the other. Empirical results also show that there is an interaction between post-traumatic stress and acculturative stress. This is to say that traumatized individuals usually report more problems also in the course of their acculturation. According to Berry's theory, there are two central issues in the course of acculturation. One of them is cultural maintenance, so continuing to rely on one's own culture. And the second central issue is participation in the host country's culture. Integration is called realizing both maintenance and participation. And the fourth one, it's not very good to read here. The fourth strategy is marginalization, which means doing neither, participating neither in cultural maintenance nor in participation. Okay. Muslim migrants mostly choose the separation strategy, which means they tend to continue practicing their own culture, and many of them are reluctant in participating in the host country's culture. They have extremely tight ties with their extended families and perceive the host country's society often as too permissive, especially with regard to gender roles. I don't want to go into much details here about all those numbers because the time is quite limited. One very important thing is that Berry's model of acculturative stress, which can be seen here, it is similar to Lazarus' model of stress. You see that social support is one very important moderating factor in this model. And this is what my studies were about. The present research program wanted to examine social support by lay help on the other hand versus professional help on the other. Professional help is difficult to give because it is either lacking for economic reasons or it is provided by nationals with little knowledge about the client's culture. So much evidence points to the effectiveness of lay help in a migration context, but there is a lack of controlled studies. Lay help can either be provided by ethnic people coming from the same culture or can be provided by members of the host society. Ethnic lay help is an interesting idea because when professionals want to provide help, they have to do it with the work of interpreters, and this is anything but ideal. Many trauma survivors are reluctant to seek and accept professional help. There is also distrust in Western medicine and psychology. And therefore, ethnic lay help might be an interesting idea to study further. The second possibility was lay help by the host population. Lay help may increase the feeling of being accepted, and in the light of xenophobia and racism expressed by other members of the host population, this might be a very valuable thing. There is some experience with so-called sponsorship programs in the USA and Canada, and also in Germany, but no controlled research. We only knew that sponsors have to be trained carefully. So the first study was about guided self-help groups for asylum seekers and refugees from Chechnya, and the second one was about sponsorships for asylum seekers and refugees from Afghanistan and Chechnya in Austria. This was the first study. At that time, about 50%, at that time, Chechens were the most prominent group among refugees in Austria, and about 50% of them suffered from post-traumatic stress. As you see, it was the typical randomized design. We assigned 94 people to the self-help condition, to CBT, EMDR, and the waitlist group. This was the timetable. So you see, there were the self-help groups for women and for men in the first two lines, and then you see the waitlist groups, and then CBT and EMDR. Of course, the bold lines indicate the assessment occasions. These were the measures: Harvard Trauma Questionnaire, the Hopkins Symptom Checklist, and the Post-Traumatic Growth Inventory. The results were quite clear. Both self-help and CBT worked very well, but only with people suffering from post-traumatic symptoms. In this subgroup, both interventions reduced post-traumatic stress, anxiety, and depression with an effect size close to 1. There was no post-traumatic growth, and very important, self-help and CBT were equally effective, and they were significantly superior to the waitlist and the EMDR condition. And the result remained stable over a period of 6 months after finishing the interventions. Here you see the interaction. You see self-help group blue, CBT in green. Both led to a significant reduction, in this case, of post-traumatic symptoms, whereas this was not the case in the waitlist and in the EMDR group. This was study number 2 about sponsorships for Afghans and Chechens in Austria. And of course, also among these groups, there is a very high rate of post-traumatic stress. And following the experiences from abroad, we tested sponsorships as a means of assisting refugees and asylum seekers in coping with problems in their acculturation. There were 63 refugees and asylum seekers and 35 sponsors. The sponsors underwent an initial training phase in the course of 4 workshops, and they were closely supervised during their sponsorships. And of course, again, the effects were compared with a waitlist control condition, similar to the previous study. A lot of measures we used, I won't read it in detail, and the results were quite clear. Again, the sponsorships worked only with clients who suffered from severe post-traumatic symptoms. And in this group, they significantly reduced anxiety, depression, psychological symptoms, and the improved ethnic contact and social support, perceived social support. You see again the effect sizes were close to 1. The positive effects also were stable over time, but on the other hand there was no effect on various other scales, for example somatoform, post-traumatic symptoms, life satisfaction, self-esteem and so on. Overall you could say sponsorships had a palliative effect, but not really an instrumental effect. So they were rather like psychotherapy and not so much like social work. This is one positive example. You see here somatic symptoms. The green one was the experimental group, and of course there was a quite drastic reduction of somatic symptoms, and this was not the case in the control group. As a negative example, you would expect sponsorships to improve contact to Austrian population, but this was not the case. Some additional thoughts on sponsorships. We found it easier to recruit sponsors than clients, because providing social support enhances self-esteem on the part of the provider, but it may endanger self-esteem on the part of the recipient. This was especially clear among Chechen men, who are typically very proud individuals and often were reluctant to accept help and support from Austrian sponsors. And some of them even suspected hidden motives on the part of the sponsors. It was somewhat easier with women. The optimal setting was to have a married couple sponsoring another married couple of Chechen descent, and thus preserving the men's self-esteem. Let me summarize. Both self-help and sponsorships were effective with traumatized asylum seekers and refugees, and both interventions were comparable to the unspecific effects of psychotherapy. But not really an instrumental effect was found, which is to say that the interventions did not improve acculturation or coping strategies, life satisfaction or social adaptation. Lay interventions are effective, but the differential indication must be considered. There is no one-fits-all procedure. An optimal setting would be to provide professional help by ethnic experts, and this might be supplemented by lay help as an interesting alternative to be examined, of course, still in more detail. All this was funded by the Austrian Science Fund. Thank you very much for your attention.
Are there any questions for Dr. Renner?